Hello everybody. Today we're gonna speak about how to start your first Smartee GS case with mandibular repositioning technology. I'm Dr. Firas Hashidar, and specialist orthodontist based in Saudi Arabia. So our agenda for today, we're gonna go with the introduction, and then we're gonna speak about the classifications, and then the wax bite registration, and then we're gonna speak about the GS two stages, and then the case submissions and workflow. So, what's Smartee GS, and what problems can be solved with this amazing appliance? So, first of all, Smartee GS is an appliance which has been developed by Professor Shingan. And it's basically using the technique of repositioning the mandible into a more favorable position, which can give us a better aesthetics and function in the occlusion. So it's a clear aligner version of the twin block and Herbist developed by Professor Gansha. So the mandibular repositioning device, which has two types, which referred to as S8, which is the S8 SGTB and the S8 SGHB, which is the sagittal guided twin block and the sagittal guided harvest. The sagittal guided twin block is for mandibular positioning originated combined subtype 1 and combined subtype 2 facial prognathism malocclusions, which has something we call the three depths, which is the deep overjet, the deep overbite, and the deep curve of SB combined by flat and horizontal rectangular mandibular body. And for the SGHB, which is for mandibular retrusion caused by condyle resorption, mandibular deviation caused by condyle asymmetric resorption, and mandibular deviation caused by condyle asymmetric asymmetration, and simple mandibular positioning originated deviation. It's basically the new technology to correct the facial prognathism. So this is how it looks like in vitro and vivo. We can see how the appliance looks like, the blocks, and how it's sitting in the mouth. So the GS technology for facial retrognathism and deviation. So GS is not only for mandibular advancement, it's also treating deviation and also mandibular retrusion and maxillary retrusion as well, using several solutions developed by Smartee, which is the S8, the S9, the S10, and the S11, and the Smartee Hook S15 and S16, the face mask. So, what's the features of the Smartee GS? So, Smartee GS helps improve the facial profile and correct the teeth both in the same time without the need of going or minimizing the need of going for surgery and extractions. So you can get your profile corrected from the same day you pop up your aligners. So we have the S8, as we spoke before, for the SGTB and the SGHB, and the S9, the S10, the S17. The combination of those can result in a better profile for your patients. So what's the GS technology concept? We know that we cannot grow the mandible in adults, and usually also in teens and kids, it's achievable, but In GS technology, we're not speaking about growing the mandible itself, rather than putting the mandible in a forward position and simulate the condyle to remodel. So the research of Professor Shingan proved that we can reposition the mandible and remodeling of the condyle. So this will improve the patient's profile from day one. The repositioning of the mandible will start as soon as the patient wears the first aligner, and the advancement amount will start correcting the full amount. Unlike other companies, so in other companies, they have their own concept, which is they do gradually advancement of the mandible, which sometimes will take longer time because each several months they will increase 2 millimeters, and then more months they will increase more 2 millimeters, which will lead to longer treatment period. But in Smartee, we try to advance the mandible as one step. Of course, there is a limitations, so we have to check the patients. Sometimes if it's more than 9, 10 millimeters, we have to take it in 2 steps, but usually we can go for one step and everything will be okay. So what's the most important thing about the GS technology? It is the unique classifications and the appliance design, which is developed specially for Smartee by Professor Shingan. So everybody will be like questioning, what are you talking about? You're forwarding the mandible, it's not gonna be stable. There's nothing proof that. So we have this great article, which is the biology of the TMG growth modifications, which has been published by Critical Reviews in Oral Biology and Medicine by the University of Sydney and by the Professor Shingan, which shows clearly that we can forward the condyle forward, and we can remodel the condyle itself to get a stable position of the mandible while simulating the condyle itself to get to that new position. So the S8 SGTB and the S8 SGHB, which is specially developed, the design, the science behind it, it's all have been developed by Professor Ganshin, which has, like Professor Ganshin has treated more than 100,000 mandibular advancement cases for adults only in China. And worldwide, we have more than 300,000 successful cases of mandibular advancement. Professor Gashing himself, he's the one of the top 2% scientists globally, and he has been researching and developing and doing a lot of research in this matter for more than 30 years. So the most important thing in this slide is the barcodes we have here. So we have the first barcode is the wax bite registration manual, and we have the wax bite registration form, and we have the third barcode, which will take you to all the articles and the science behind the mandibular repositioning technique. It's all published, a lot of articles. You'll see cases, all proved by those articles. So, what's the common cases and chief complaints we can like treat with the Smartee GS? Deep overbite, deep overjet, deep curve of SB, 3 depths, mandible deviation, crossbite, facial prognathism, and facial retrognathism. Mandibular deviation and reduce or avoid the tooth extraction or the need of surgery. So a lot of doctors, they will ask like, I have this case, but I think the surgery is the answer. So some of the doctors will think this complicated cases cannot be treated only by aligners or cannot be treated by the routine treatments. So in Smartee, we combine a lot of different treatment ideas, technologies, supported by science to get to a better result in an innovative way. So the Smartee GS product series, it has unlimited set of aligners, unlimited free refinements within 6 years. You have two sets of free retainers. In this type of treatment, we reduce or avoid the tooth extraction or surgery, improve the facial profile, and correct the teeth both in the same time with mandibular reposition devices, unlike other companies that will take you into 2 stages and longer treatment. So we're gonna speak about what makes us special, what makes us different than others, which is the classifications. We have our devices, and we supported that by science, by classification. Shingan classification, we can see that we have, based on the facial profile, clinical manifestation, molar relationship, and the classification. So, firstly, we can see the protruding teeth and non-prominent bone, which has protruding teeth, non-prominent bone, which can be treated by GS. In this case, we have a class 1 molar relationship. So it's basically dentally can be treated with the appliances, which is the dento-alveolar originated. And then we have the class 2 molar relationship, which has non-protruding teeth, prominent bone. We have the deep overjet, but we have shallow overbite and shallow curve of speed. In this type of patient with a class 2 molar relationship, we can treat that by the Smartee GS SGHP, which is skeletally originated or joint originated. So next, we have the class 2 molar relationship, but in this case, we have protruding teeth, mandibular retrusion, which has the 3 depths: deep overjet, deep overbite, and deep curve of SB. In this type, we use the SGTB, which is by the classifications of Professor Shingan. It's called mandibular positioning originated. Then we have the class 2 molar relationship with non-protruding teeth, prominent bone, mandibular retrusion, and we have the deep overjet, deep overbite, and deep curve of SB. We can use the SGTB, which is the combined subtype 1, while we're having a class 2, but we have, for example, protruding centrals or uprighted. And then we have the class 2 molar relationship, protrusive teeth, prominent bone, mandibular retrusion, and we have the 3 depths. So we can treat that by SGTB. The combined subtype 2, which is manifestation, is retrusion of the centrals. So the most common 3, those we talked about, those the most ones we use Smartee GS for treating it. This is a clearer view for the classifications for malocclusions with facial prognathism. We can see the first one, which called the fundamental dentoalveolar, and then we have the fundamental skeletal, which has increased in the bone structure skeletally. And then we have the mandibular retrusion dentoalveolar, and then mandibular retrusion skeletal subtype 1. We can see how the upper incisors are uprighted, or sometimes it can be a little bit proclined. And then we have the mandibular retrusion skeletal 2, and which has manifested by retrusion of the upper incisors. Those the 3 types we focused on. And then we're gonna go now for the wax bite registrations, which is very important if you want to get to a better result. If you want to your cases to go smoothly, we have to do it in a proper way. So this is the clinical protocol we're gonna follow for the mandibular forward repositioning simulation, determination, and wax recording. So the wax registration for the mandibular repositioning, based on the facial profile, we have the facial prognathism, and we have the four types, which is the mandibular positioning originated in the combined subtype 1, combined subtype 2, and the mandibular retrusion caused by condyle resorption. In today's lecture, we're going to focus about these types, but we have other types of wax registration for the mandibular deviation. We're not going to focus on it today. So for the mandibular positioning originated, we have in the sagittal direction, we have to get at least 2 millimeters overjet for maxillary anterior teeth. And vertically, which is very important for the most of the GS cases, we need at least 4 to 5 millimeters posterior opening. So we have an enough space to produce the blocks for the device. So next, we have the combined subtype 1, which all be treated by the SGTB, and for the upper and lower anterior teeth lined up edge to edge. And then same for the vertical direction, we need 4 to 5 millimeters of posterior opening. And then for the combined subtype 2, we need 1 millimeter crossbite for the anterior teeth. Someone is asking why we need to do it in a crossbite, for example. In the subtype 2, we have retrusion in the upper incisors, right? So if we go ahead and take the wax bite in edge-to-edge relationship, and then while correcting the inclination of the upper incisor, we will end up with increased overjet. Then we have to correct it again. That's why we take it in a 1 millimeter crossbite, and then we will end up with a better relationship after. And then for the mandibular retrusion caused by the condyle resorption, which can be treated by the HP, the upper and lower teeth should be lined up edge to edge, but the anterior teeth should not be opened. Those are the ones we spoke about. And then we have 4 steps to follow to get a perfect wax bite. So the first step is to take an entire oral scan to record all the dentition, upper and lower. And if we are combining our treatment with other devices like the S11, S16, we need to take a full scan for the palate. This is very important. Repositioning simulation. We have to decide the new mandibular position and train the patient on it so we will take it easily when we put the wax for the patient. Then the wax placement is to hold the new mandibular position, and then the posterior intraoral scan to record the new position of the mandible while the patient is forwarding his mandible. So firstly, we have to take a full scan, upper and lower. Number 2, repositioning simulation to decide the mandible new position. So in the first one, the upper incisor is a little bit proclined. So we need 2 millimeters overjet remains so we can get enough space to correct the inclination of the upper incisors. So if the upper incisors are uprighted, in this case, we go for edge to edge. But if the upper incisor it's retroclined, we need, as we talked before, we need at least 20 millimeters of crossbite to correct the position properly. And then vertically, we need at least 4 to 5 millimeters of posterior open bite. So we have enough space to produce the blocks in the posterior area. Doesn't matter if the anterior is open or closed. The most important one is the posterior open bite. So transversally, we need to put the facial midline coordinating with the chin point as much as possible to avoid any deviation in the end. The wax placement. So first we have to fold the wax 3 or 4 layers to get enough opening. And then we ask the patient to bite on it while maintaining the midline and covering up to the first premolar. And then we keep the frontal area clear in order to manipulate the new position. The buccal segment without wax for scanning after we get the correct bite. So the posterior intraoral scan, after we established our new bite and we verify it, we go ahead and scan the buccal segments to get this bite in our scanner. So let's summarize it. Firstly, we take entire scan for dental structures, upper and lower. Then we train the patient for the new position and then we simulate it. We train the patient on it and then we place the wax, ask the patient to bite for the new position we already simulated with him. And then we take the posterior scan for the new position. And after that, we will get this kind of scan in our scanner. If we don't have enough posterior opening, please rescan it again and verify the position, because otherwise your scan will be rejected and you will lose your time with your patients. So in the GS, usually we have 2 stages, just like a twin block, the conventional twin block. We start with the appliance. After we finish the first stage, we go to the fixed braces. But in GS, we have 2 stages, the mandibular advancement stage and then the settling stage. So this is an overview of the treatment protocol of S8 SGTB. We have phase 1, which is the orthopedic and orthodontics, which is the mandibular repositioning together with individual teeth correction, which can last for around 10 months. And then the phase 2, which is the orthodontics phase 2, which is for intercuspation and settling of the posterior open bite. As we know, those type of appliance, one of the side effects, we will get a posterior open bite. So we have to settle it and then we get a good bite for the finishing phase. So, and the phase 1 staging of SGTB cases, this is a chart of the stages. So we have the stage 1 to 3, which is the mandibular adaptation. So in this 3 stages, there is no tooth movement. The blocks are there. The patient will accustom to using it. He will use it. And then from stage 4 to stage 28, those the stages where the mandibular repositioning is happening. So the movement is designed and the block is designed. Stage 29 to 30, which is the mandibular retention. In this stages, there's no tooth movement. The blocks are there. We have to take the oral scanning for the next phase after verifying that we already got the amount that we needed. It is stable. We go ahead and scan, and then we wait for the aligners of the second stage. The stages 31 and 32 is the simulation of the final position. So it's suggested to wear the aligners for 10 days per stage in phase 1. So in phase 1, where we are advancing the mandible, we need to use the aligners for 10 days. And then in phase 2, we're gonna use it for 7 days. Because it's only for alignment and set stages. In most stages, we ask the patient specifically to eat with the aligners so we can simulate the new position. We can get the adaptation of the muscle and the condyle. And for stages, for example, 1 to 3 and stages 28 to 30, Smartee gonna provide you with two sets of aligners, aligner A and aligner B. So in case of the page, in case of the breakage or something, you have a backup. So let's go through it again. During the staging of twin block, stage 1 to 6 and 29 to 30, will Smartee will provide you with two sets of aligners, as we said, because one of is backup and one is for using in case breakage happen, you have a backup. So wearing time is different, depends on the phases of the treatment, phase 1 and phase 2. So we said phase 1, we have 10 days, and phase 2, we have 7 days. And the stage 29 to 30, we need to rescan so we can determine if the position achieved is stable or not, and we can move to phase 2. So this is for the HP, is a little bit different. We have stage 1 to 28, which is the mandibular positioning directly. We have the tooth movement designed and the herbist is designed. So stage 28, 29 to 30 is the mandibular retention. So no tooth movement designed, herbist is designed. We take the oral scanning to start the phase 2. And 31 and 32 phases is for the simulation. Same with the twin block. We have 10 days for stage 1, phase 1, and we have 7 days for phase 2. This is very important. And also in HP, we have to ask the patient to eat while using the aligners for the adaptation. And there is two sets of aligners in stages 29 to 30. So one of the most important thing while advancing the mandible is how we gonna control the anchorage. So the anchorage, we can control it in two ways. The first one is the lip bumper, which can be seen here in red. And then the second way to control the anchorage is using TADs in the lower and attach the TAD with elastics to the lower aligner. So this is how the lip bumper looks like inside of the mouth of the patient. So we always ask the patient to keep his lips closed so the force of the lips will transfer to the lip bumper. We prevent the lower incisors from brooklining while advancing the mandible is one of the side effects we don't want. So we counter that side effect by using lip bumper or TADs in the lower. So this is what notes, like a lot of doctors using different systems, they don't know about it. The patient should eat while using the GS aligners, which is help in adaptation of the new position, adaptation of the condyle, simulation the condyle, and also adaptation of the muscles. So one of the things a lot of doctors always asking me, I'm not familiar with the classifications. I'm not sure which appliance I should choose. For example, HB, TB, should I include S11? Should I include other things? So if you don't have like a specific information about it, we can submit the case and then the medical team in Smartee will help you with the diagnosis and the proposed treatment plan, but we need a full set of records. So the patient, for example, we are afraid, for example, the patient will break the aligners while biting. So usually we ask the patient to chew light things, noodles, for example, soft eating. The focus on it, not like chewing the food itself, rather than making the muscles and the condyle adapt. Which is very important, sometimes the patient will feel some pain in the joints. This is usually normal in the first days, but if the pain is like unbearable, he should report it directly to his orthodontist. But usually in the first days, he will suffer from some pain, which is tolerable, and it will go step by step. So we have a schedule of revisits, which we need to focus on it, especially in the first phase of mandibular repositioning. So 2 months after the initial wearing, we should schedule a revisit for the patient to check if the patient already using the aligners properly. He accustomed to wearing the aligners while eating, and you should ask the patient for specific feedbacks about the aligners. If there is any changes in the facial profile, joint region, pain, eating, not eating, those kind of feedbacks, we need it in the first 2 months. So in the fourth month, we have to check whether the mandible is a protruding position, or patient also can retrude it to the original position. So in the fourth month, we check we already achieving the advancement position, and we ask the patient to retrude to the original position. So in this type, we already know the amount of advancement that we are aiming to. So we also check the jaw position, the facial profile. If it's more natural, it's gentle, and the facial is harmless. In the sixth and seventh month, we suggest the doctors to take either OBG or a CBCT. So in the seventh month, we ask the patient, we check the patient's new position, and we check the condyles to see if there is any new cortical bone forming around the condyles. Usually in the distal areas of the condyle, we're gonna see some new cortical bone forming in that area. This is where we can see that we are already getting to the point that we want to reach. In the ninth month, we check if the mandibular position is stable. How are we going to check it? We'll ask the patient to see the new position, and we try to push the mandible backward to see if it's already stable. And we check the mandibular curve of Spee is already leveled. And we check also the posterior open bite bilaterally to see if the patient is ready to move to phase 2. So, to observe the changes in the joint morphology, in the 7 months, we take an OBG or a CBCT. So, what's the key points in phase 2? As we said, in phase 2, how we can see if we are ready to move to phase 2. So, the preparation required and the solution for the posterior open bite. So, how we check if we are ready to enter phase 2 after 10 months of advancement? The mandibular position has been very stable. We push it, it's not pushing back. The position is stable. The curve of Spee is leveled, and the open bite posterior is within 3 millimeters. It can be considered to enter the phase 2 to start the mandibular reposition and start the second phase, which is the settling of the bite. Preparation required before entering phase 2. After the advancement in phase 1, we take the oral scan, we check the stability of the new position, and we check if we need any more settling, or we need, for example, a gradual reducing of the blocks to get to a better posterior open bite, reducing the posterior open bite. So what's the solutions we use for the posterior teeth in phase 2? If the open bite posterior is less than 2 millimeters, so we need further leavening of the curve of Spee, we add attachments, and we will design for extrusion of the posterior teeth. If the open bite posterior tooth is more than 2 millimeters, several stages of occlusal splints can be added. And the jaw can be built by gradually lowering the occlusal splints or with vertical traction, which is elastics, for example, if it's more severe. So right now we're going to speak about the case submission workflow. So basically, when you go to submit a case, you have to fill the basic information of the patient. After that, we go and choose the treatment type. So when you choose the treatment type, you choose Smartee GS. When you click on Smartee GS, you will get an icon here that will show you the wax registration guide. You will get a PDF file with all the steps explained. We go ahead and submit the photos, the regular photos. And then we start to submit the panoramic X-ray, the cephalometric X-rays. And then after that, we have to submit more photos, which has the facial frontal while the patient is biting on the new position and the wax is in his mouth. And we take those facial frontal, facial side profile, overjet and overbite, and we take intraoral right, intraoral frontal, and intraoral left to confirm the new position we are aiming to, and also to see how the profile of the patient will looks like after we advancing the mandible. Is it natural? Is it better? So he will decide that. Then after that, we go to the prescription. In the prescription, we have to fill the facial profile. So usually the ones in the black, you can leave it or you just fill it if you want, but the mandatory ones in red. So you can choose the appliance you want to include. You can choose the serious device you want to include as well. When you click on any of the devices, an explanation with the picture will pop up and it will explain this appliance in details. Just like we see here. For example, if we click on S8 or S9, S16, S11, whatever appliance solution is there, you can see each appliance with the detailed explanation and objective treatment for this appliance. So there is a detailed introduction for each device. Doctor can check the info and decide the appliance device based on the patient situation. After that, we submit the STL file. You have two ways, either to submit a full scan with repositioning, which is the mandatory one to submit, or you can submit also the full scanning for the upper and lower and the scanning with the mandibular repositioning situation. So in the STL uploading part, submission workflow, the scanning must include whole palatal if S11 or S16 is designed. So if you want to design an expander, the invisible expander, which is the S11 or the NANS or any appliance that will rely on the palate, we have to take a full palatal scan. And then, as we said before, that you can either submit the original bite registration STL file with the mandibular positioning or upload only the STL file for the repositioning and the full scanning, which is the mandatory one. In teen cases, for example, in teen cases with mandibular repositioning, if you cannot, for example, the patient is growing and he's annoying, you cannot take a proper wax bite. In Smartee to simulate digitally. So that's it for today. Thank you everybody for attending today. I'm happy to add any questions and doubts or regarding this amazing yes. Ready for what? Sorry guys, I got disconnected. So thank you everybody for
The voice
attending.
now is, yeah, the voice now is clear. Yeah.
Yes. Go ahead, Dr. Sarah.
Actually, now your voice is clear. Just wanted to say
Yeah,
that.
I got disconnected in the last minutes.
No problem. It's
Fortunately.
okay. No problem. It's okay. Actually, doctor, there is like a simple question, which is like actually from common question from the our lovely doctors. Usually,
Yeah.
they are asking like, how long does it like? Usually, I understand different cases, but they are asking usually, how long does it take for the first stage and the other stage?
Okay. So usually the first stage is around 10 months based on the amount of the advancement we achieved, but usually within 10 months we can reach to the position we want. Second stage is depending on the amount of crowding or spacing or the amount of posterior open bite we gained from the first phase. Let's give or take 6 to 8 months and we can finish the cases. So usually an average of 18 months can be
Okay.
enough for the cases. So different
Okay.
cases,
Okay. Thank you, Tom.
severity, yeah, it's gonna be different type.
Okay, thank you so much, doctor. Yeah, also one question, like, how do you recommend to wearing time for the aligner? Like, unlike the others, yani, some people they are thinking about, some doctors they're thinking about to wear the one pair of aligner 10 days. Some other they are saying no, or for 2 weeks. Some other they are saying 7 days. For GS, what is your recommendation?
Okay. For GS, the recommendation is 10 days for the phase one. For the advancement
Okay.
phase one, 10 days to 2 weeks, that would be fine. But the recommended is 10 days, depends on the severity of the case. Some of the cases we put the aligners for at least 2 weeks. But usually phase one is 10 days, phase two is 7 days. That's the recommended time of wearing.
Okay. Thank you so much, doctor. It was a lovely night, to be honest, and you
You're so
simplified
welcome.
everything, actually. Thank you so much. See you soon, doctors, inshallah, with like feature
Thank you, guys.
things in Smartee. Good night, all.
Thank you, guys. See you next time.
Dr. Firas, may I have a question, please?
Doctor, actually, maybe Dr. Firas is he left now. You can just send us in the chat box here for the question that you wanted to ask about. Okay.
Okay, doctor. Thank you very much because the internet
Uh,
connection was not stable. That's why I want to ask. Thank you very much.
okay, okay, no problem. Feel free just to send here in the chat box. Thank you.
Thank you.